Welcome to the Aging Boomers. I'm your host, Frank Sampson, where we discuss so many of the issues facing boomers, their parents, and what, of course, we know is an aging population. I'm right in that category as well. So I just want to thank you all so much for joining us. Thanks for all your support. As I mentioned before, we're now on iHeartRadio. So if you're listeners on iHeart, you could just search the Aging Boomers, and you could subscribe to those shows, to our shows. Of course, we're on iTunes, and Aging Boom. You could just go to agingboomers.com, or make it easy on yourself and just download the free app, the Aging Boomers free app, on your iPhone or Android phone, and you could keep getting all these shows updated, which we do a couple times a week, usually every Monday and Friday. So I want to let you know that today's show is sponsored by Senior Care Authority. Senior Care Authority is a professional senior placement and elder care management organization that has a national network of professionals to help in determining the right path for seniors in receiving proper care and supervision, whether it's in-home, assisted living, residential, or memory care. You can talk and even meet with a senior care advisor in your area. Just call 888-809-1231 or go to seniorcareauthority.com. So I'm really excited about our next guest. I always say that, but this one is really pretty neat because she's really put together a very innovative program. Nina Angela Downey. She's been practicing physical therapist since 2003. Nina has experience in spinal cord injury, stroke, and brain injury, as well as home health physical therapy that she's practiced throughout the Central Coast of California. But it doesn't really matter that she's in the Central Coast of California, because Nina has come up with an innovative approach to physical therapy called WebCam Physical Therapy. So she's taking advantage of all the technology today, and I really want to get into that, but I'm first going to ask Nina, first of all, welcome, Nina. Welcome to the Aging Boomers.
Thank you, Frank. Thank you for having me.
Yeah, it's great to have you. So I guess I just don't want to assume that our listeners know exactly what physical therapists do. So kind of give us an overview of really the scope of what physical therapists do and what they maybe don't do, if that's appropriate as well.
Actually, it is, because most people have a predetermined definition of physical therapy, and it usually relates to something they've had done to themselves or someone who's close to them, such as recovery from a serious injury or surgery. Maybe they're being rehabbed from a broken hip or shoulder surgery or a knee replacement. And that's about the extent of what most people think physical therapists do, and that doesn't really give you a warm and fuzzy feeling. So physical therapists have quite a scope of practice. They are first and foremost taught to do assessment, because in any medical situation, you want to make sure you do no harm. So the first thing that a physical therapist does is the assessment to see if what the person is complaining of, what their concern is within the scope of practice, which is basically musculoskeletal. So does it have to do with your bones or the muscles that work the bones? Well, then we can help you. But quite often, a person will come with a complaint of a certain pain or certain symptoms where we will know right out of the box that they need to be referred to a doctor or maybe a speech therapist for swallow study. So the most important thing a physical therapist does is assessment. Following that, it opens up quite a few different areas. orthodpedic-rehab. That would be what most people think of with physical therapy. Rehab from injuries and joint replacement surgeries, increasing strength and range of motion. But neurologic rehab, and that happens to be my favorite. That is my specialty, right back from school. That was the one that got my interest. And in neurologic rehab, we deal with diagnoses such as stroke, and stroke is variable from person to person because the brain is so complex. Spinal cord injury, various levels, brain injury, and once these people have gotten out of the hospital, if they're lucky enough to do that, there's so many areas that they need to be assisted in daily function, and the neurologic rehab basically is caregiver training. And for the baby boomers and for the aging population, seniors, there's a lot of neurologic diagnosis out there where the caregiver needs to know how to deal with someone who has these very complex brain or spinal cord injuries. So that is the one that I'm the most excited about. We also do education and teaching people what's going on with themselves or what's going on with their loved one that they're taking care of, giving them information to help them cope better. And that's a very important one for this population, these caregivers who maybe weren't caregivers yesterday and suddenly they're thrown into it today. So teaching people what the diagnosis is, how it presents, and how they can best help that person that they're caring for.
So a physical therapist, I mean, does each physical therapist have their own area of expertise? I know if you say a doctor, well, what kind of doctor? If you say even a dentist has areas of specialty, almost every field does. If someone were to go to a physical therapist in their area, could they expect similar type of education and experience from each one, or is everybody has their own area of expertise?
That's a very good question. When we get out of school, we have a basic groundwork for all these areas. And with physical therapy having so many different areas like women's health and geriatric and pediatric, children, working with just neuro, working with just orthopedic, as a student becomes a practicing therapist, they will go into an environment, hopefully, that they really enjoy. So they will have all the basic skills, but depending on where they work, they will really improve actually working with people and seeing the variety of different, from person to person, everything is different with rehab. There's no cookie-cutter approach. So, for example, I started with the Rehab Institute of Santa Barbara, which is now Cottage Rehab, and that's where I got to take my neurorehabilitation to the highest level, working with all those diagnoses. But when I left there, I went into home health. Home health was a different set of skills, and that you cannot be a home health therapist where you're pretty much on your own when you're in the home unless you've been a supervised therapist for over 5 years. So then you get in the home and you get new skill set. So depending on what people need, for example, some physical therapists will be hand therapists. They focus on hand surgeries and hand rehab, and that is taking the basic knowledge and saying, this is what I want to be my specialty. So you might have to search from therapist to therapist if you had a special need for a special treatment.
Gotcha. So now I'm going to hit you with the question that I've been very anxious to ask. What is WebCam Physical Therapy, which you've kind of started, right?
Exactly. What led up to that was my time in home health, where I was going into homes and seeing the extensive need for a variety of services in the home. What bothered me was when you go in to a home, you are usually paid by either private insurance or you're paid by Medicare, and you must follow the guidelines. And the guidelines did not always take into account multiple caregivers to train, that the client, needed more time from the therapist to gain function then, and you were basically trying to prove your point instead of getting in there and doing what you're doing. With WebCam Physical Therapy, which one of the questions is, does my insurance pay for it? And at this time, no, but I have a feeling in the future they will see the value of it. WebCam Physical Therapy was my attempt, and successful, I'm very happy to say, to reach out over the United States into people's homes and be able to be one-on-one using, by the way, Skype, which is, for most people, they know what that is. And it's basically a way to have visual and audio, see and hear, just like you're in the same room with the person, with a computer or a mobile device or a tablet or a pad, all these new devices that are making this so easy.
I'm actually talking to you on Skype right now. We're not doing the video, but we're doing the audio on Skype right now. So it's
exactly
right.
It's wonderful. So it's almost like you're right here. And what I have found out with this, the idea with the WebCam Physical Therapy is I wanted to be able to get into each person's home, see exactly what they needed. And that's the part. It is seeing it without having to actually be there. And, for example, if someone says, my mom had a stroke and we don't have therapy. We don't qualify for therapy. This is an issue. Perhaps they don't qualify or they may not have the insurance. And I don't know how to properly get her out of bed without hurting her. How can I do this? Well, they have the computer or whatever mobile device set up in the room, and with the agreement of the patient and the caregiver, I can instruct them as they're watching me in my office where I have a bed set up, a massage table, and I can demonstrate for them and I can instruct them through it and I can say, this is what you need to do. And they can spend 15 minutes with me and they can spend an hour with me. They could spend a half an hour, practice what they're doing, and then get back to me a week later if they need more. It is so custom, detailed, to just what the client needs. And I love that. I'm so fascinated by it. So what happens is people go to my website and they can see the plethora of things that I do. They can read in detail how Skype works and and you do have to have a computer or some device. And if there are some seniors who don't, more than likely someone in their family or a friend does. And this is worked out quite well. And they can get on my contact page and say, hey, here's the problem. Here's what I'm concerned about. Here's what I think I need. Just send me an email or leave me a voicemail. The next thing I do is contact them, the method they wish, either a return email or a phone call. And this is where I do my first general assessment. I want to hear what's going on. You're having what kind of pain? And this is where I will immediately weed out something that I can't do. This is before they have purchased any time. And I'll listen. I don't have to see them for this, but I will listen to them and figure out what's going on and say, yes, I can help you. No, this is what I think you need to do. Then from there, if we've determined that I can help them, caregiver training, a fitness program, teach me about my diabetes, anything like that. Then we set up approximately the amount of time that they think they need. They go back into the website. We set a tentative appointment, and they go back into the website, purchase the time, and it's through PayPal. It's as little as 15 minutes. So it's basically they're going to pay for exactly what they're going to get. There's no middleman. You're paying for a service like you go in, you pick up a product, you buy it, you pay for it, then you take it home. You're getting what you paid for immediately. So, and the feedback is immediate, which is wonderful. So this way, people they like convenience. And the three problems that caused me to create the web therapy was, one, there are areas in the country where people do not have access to physical therapists. It's a long, long distance away. And this lets me come right in their home. They don't have to travel. They don't have to do anything. And most of what they need is to be able to function in their home. Some people don't have health insurance, or health insurance that covers physical therapy. Right. So they can purchase that. Yes, go ahead.
No, go ahead. Go ahead.
Okay, they can purchase that 15 minutes and see if this is going to work for them, or that half an hour, or that hour if that's what we determine. And they're getting exactly what they pay for in their home, talking to me one-on-one, face-to-face. And it could be a one-time deal, or it could be something where they come back multiple times, but it's so at the client's need and desire. It works so well. And I've been all over the United States, which is pretty fascinating.
That's great. I mean, I would think that someone who needs physical therapy, they're hurting in some way. And to the point that maybe getting into a car and driving might make it worse. So I think it's just it's a wonderful service. So I want to clarify a couple things, all right? Number one, I mean, what percentage of the time are you working with a third party who is then working, let's say, with the senior? Are you usually working with a caregiver or even another physical therapist, or are you sometimes one-on-one with the patient?
Well, right now, and this has a lot to do with our aging population, I would say maybe 40% of the time I have a baby boomer who's taking care of their parent. And
Gotcha.
They can't afford to have caregivers come in the home. They just can't do it. They have to do it themselves. They're just in that situation. And one of the things that is I'm spending a lot of time teaching the family caregivers is equipment. What's happened is they've been sent home from, say, the hospital with a Hoyer lift or a wheelchair or a Commode chair or so much equipment. They don't know how to properly adjust them. They don't know how to use it. They're afraid they're going to hurt their loved one, and they don't know how to transfer them, and they don't know even how to turn them to keep them from their skin breakdown. There's so much they need. So it's education, it's equipment. Sometimes it's equipment recommendations. Sometimes I'll say, I realize they sent you home with this, but if you change out, for example, the Hoyer lift sling that they send you home with, which is mesh, scary, and uncomfortable, and they were to get a different type of sling, and that's actually on my website. I'll go into that later. It would change everything.
Maybe before you
so
continue, explain to people what a Hoyer lift is. I think most people probably don't even understand what it is.
Exactly. It is one of those mechanical devices that it's like a hand crank. It's air pressure. And if you have a patient who cannot get out of the bed into the wheelchair or out of the bed onto a Commode chair for various reasons, it could be from a stroke or it could be because they're non-weight bearing. They can't put weight on their legs. It involves a sling that is placed correctly under the patient and then hooked up by these hooks to a unit that has an arm that is over the bed, and you hook it into that arm and it lifts the patient up sort of like a baby swing, and then you pull this unit back and set the patient into the chair. And for most people, they've never seen one. You're right about that, and it's very, very scary. It's one of the only ways to do a what we call a dependent transfer. Otherwise, you have to have 2 or 3 people, and that's not good for the caregiver or the patient trying to lift patients in and out of bed, on and off the Commode. And as far as on my website, there is a free video that anyone, actually I think I've just hit 30,000 on views.
Wow.
That's where I just got so excited about this, because I knew there were so many people who didn't know what to do with it. So they were saying, that's all right, I'll get my son over here and we'll get so-and-so and we'll transfer him. And then people just stay in bed most of the time, and it's just a spiral downward if you don't know how to use it right. So it's on there. It's a free video. There's a number of them that people should have access to that information at no charge. They just need that.
So I know I'll ask you before we end the interview how people can get in touch with you, but as long as we're on the subject, why don't you tell everybody your website and how do they get to these videos, how would they get in touch with you, etc.
Okay. The website is called MyPT, as in physical therapist, 4, and that's the number 4, health, HEALTH.com. And if you go to that website, it will take you to, if you go on to there, it'll take you to my website, to the home page, where there is an informational video that basically explains how it works. It's somewhat of a new concept. I at this point don't know of anybody else who's doing it, but I was just more interested in getting it out there and giving it a run. So that explains the concept of WebCam Physical Therapy, and then you can proceed through and see the things that I do. And at the end, the very end, there is a list of videos. And you can click on those videos, and you can click on them as much as you want and see how to do the Hoyer lift, a transfer board transfer. There's wonderful hand exercises in there. Those are just general information that are out there free. If you wanted to contact me, there is a contact page, and you go to that page, and it allows you to send me an email or to call and leave me a message. And I make it perfectly clear this is not type of a 911, like when you call the doctor, they say if this is an emergency. Really, if this is an emergency, this is not the place to call. But, if you're hurting and if you're frustrated and you just don't know what to do with your loved one and you want to give the best care and you don't have access to that, that's exactly what I can do. So that's the type of message that goes in there. And I strive to return all calls and emails within 24 hours. And then we can talk. And that way we figure out what's going on.
It's pretty exciting. I know when you told me about it, I said, wow, we got to have you on the show. I love innovative things like this. So let me ask you this. I don't think it's necessary for our purposes here to get into your costs, but would you say that if someone did have access to a local physical therapist and they didn't have insurance or the insurance wasn't covering physical therapy and they're on a budget, would you say generally the costs of having a physical therapist come out to their home if they would do so, or they might not even do such a thing, or let's just say the cost of a local physical therapist versus a service that you would provide via webcam, would yours be lower, you think, generally?
Yeah, mine is lower simply because of the fact that there is no middleman insurance-wise. We've really cut costs here. It's just myself and the patient. And I certainly don't mind mentioning my fees. The whole idea is that people are going to try to figure out with me what time they need. The least amount is 15 minutes, and that's $25. And the max is an hour, which is $100. So it's basically $25 for 15 minutes. For quite a long time, I was traveling. Sometimes I still do local patients in their home, private physical therapy, and for that I charge $105 an hour, and that's based on driving, the cost of driving. Now, when you get, if you have insurance, some insurance will pay for physical therapy, and I would say, if you can get home health, do so. But what happens is there's usually a restriction on the number of visits you're going to get that your insurance is going to pay for. Mm-hmm. Perhaps once that has been completed, you may not be exactly where you want to be. That would be a good time to contact me.
Gotcha. So we just have a couple minutes left. Boy, time just flew by here. If you had to suggest to people kind of the steps to take if they're interested in this type of service. I mean, you kind of went through the website and things, but maybe I'm going to ask it a different way. What would be the type of situations that are best to use this type of service? I mean, if you had to describe and say the perfect situation would be this situation, someone needs physical therapy for this or that, they have a family member that can help. I mean, what would you describe as a perfect situation for your type of service?
Okay, I would say it falls into three categories. The first being if you have caregivers in the home that you want trained. This is all if you're not having access or people coming in the home and from a physical therapy point of view. So you got caregivers that need to be trained or you need to be trained yourself. And under that umbrella of now being the caregiver are multiple things, such as understanding the effects of the medication that your family member may be on. How to use and monitor blood pressure, if that's something you need to do, how to do a finger stick for diabetes, understanding the patient's diagnosis. So if you're a family member and you really don't know what to do on any of those areas or things that I haven't even mentioned, get in contact with me. Seniors, there are quite a few seniors who have knowledge that they should be exercising, and many people feel like, oh, I'm older, I won't benefit from it. You will absolutely benefit from it.
Absolutely.
But here's the caveat. Caveat is this: with the many medications and the many diagnoses that seniors are on, you can't just do a basic exercise program. You need someone to guide you through, who knows about diagnosis, who knows about how blood pressure medicine blunts the heart rate and blunts the blood pressure. And you need to know how to exercise if you're diabetic. So these are specialty things where it's one-on-one. I'm finding out exactly what's going on with you, and I'm telling you how to do the best exercise program possible. And finally, and this is an important one, if you're falling, if you have, or if your family member is falling, get in touch with me. It's a home safety eval. I can watch her walk or him walk or struggle to walk. I can make so many recommendations that can help reduce the falls, because that's just a slippery slope.
Great. Nina, thank you so much for joining us. It was wonderful, as I knew it would be. And you could get in touch with Nina. Go to my PT, like physical therapist, mypt4, the number 4, health.com, mypt4health.com. And if they just wanted to call you, Nina, what's the best number to reach you at?
Area code 805-350-5255.
WebCam Physical Therapy. Check it out. It's I think it's going to be booming. and you've heard Nina right here on our show first. All right, great. Nina, thank you so much. We'll have you back. Get an update of how things are going, all right?
Wonderful. Thank you so much for having me, Frank.
Thank you so much. And I want to thank everybody out there for joining us. Send our link, Aging Boomers link, to friends, family. Have them go to iTunes, iHeartRadio, download our app, whatever's easiest for you. So, again, thank you so much for joining us. Be safe out there, and we'll talk to you all soon.